Welcome, and thank you for joining us. Our next presenter is Dr. Lynn Bird. Dr. Bird is a dysmorphologist, clinical geneticist, and professor of clinical pediatrics at the University of California, San Diego, based at Rady Children's Hospital. Dr. Bird has over 25 years in clinical practice and leadership of research protocols focused on improving care and management of Prader-Willi syndrome. Dr. Bird will report findings from a clinical trial of cannabidiol to address hyperphagia and obesity in patients with Prader-Willi syndrome. Please welcome Dr. Bird.
Dr. Bird, check your mute, unmute yourself, sorry.
Okay, this should be better.
Fabulous, thank you.
No worries. Hi, I'm Lynn Bird from the University of California, San Diego and Rady Children's Hospital. And on behalf of Radius Health, I'm pleased to report the preliminary results from a randomized placebo-controlled phase 2 trial using synthetic cannabidiol oral solution in 7 individuals with Prader-Willi syndrome. Here are the disclosures. I've been a paid consultant for Radius and have received funding from several other pharmaceutical companies to conduct clinical trials in Prader-Willi syndrome. Dr. Phillips and I were both investigators in the trial that produced the data I will speak about. 3 of my co-authors are employees of Radius Health. As this audience well knows, hyperphagia and related behaviors are among many unmet needs for individuals with Prader-Willi syndrome. In recent preclinical studies, the role of the endocannabinoid system, including cannabidiol, in control of appetite and weight gain have been demonstrated. In humans, there is evidence that the endocannabinoid system affects weight and appetite. The exact mechanism of action of CBD is unknown and believed to be multifactorial. In multiple clinical studies with plant-derived CBD approved for the treatment of refractory seizures, decreases in appetite and weight have been demonstrated. RAD11 is an investigational synthetic CBD oral solution, which is chemically identical to plant-derived CBD with controlled purity and containing no alcohol and no psychoactive ingredients. RAD11 is formulated in a medium-chain triglyceride vehicle at 100 milligrams per milliliter, and the finished drug product appears as a clear to pale yellow solution containing vitamin E as an antioxidant, saccharin as a sweetener, and strawberry flavoring. Over 150 individuals, including healthy volunteers, have been exposed to RAD11 in prior studies. This audience is quite familiar with symptoms and manifestations of Prader-Willi syndrome, so I will present only the highlights. Hypotonia and feeding difficulties at birth give way to later hyperphagia, the relentless, insatiable drive to eat. Additionally, metabolism is slow in Prader-Willi syndrome, and the combination of hyperphagia and slow metabolism sets patients up for obesity and the many resulting complications, such as diabetes, hypertension, heart disease, and obstructive sleep apnea, all of which contribute to morbidity and early mortality. There are other behaviors that contribute to the difficulties experienced by individuals with Prader-Willi syndrome and their families, including anxiety, habitual skin picking, oppositional defiance, and cognitive rigidity. All of this results in a significant impact on the quality of life of families. Hyperphagia and anxiety are the key clinical features that prompt caregivers to seek medical attention, and there are no FDA-approved therapies to treat hyperphagia. The goal sorry about that, the goal of RAD11 treatment is to reduce hyperphagia and the resulting behaviors. As mentioned earlier, the mechanism of action of CBD is unknown and likely multifactorial. There is evidence that it may act as an antagonist or inverse agonist at CB1 receptors in vivo, which may affect appetite, food consumption, and the reward system through indirect action with anandamide. Anandamide is an endogenous neuromodulator, part of the endocannabinoid system. In addition, there is some indication that CBD has anxiolytic properties potentiated by the serotonin system that could reduce anxiety. The phase 2 study of CBD and Prader-Willi syndrome was randomized, double-blind, placebo-controlled trial intended to assess the safety and tolerability as well as efficacy of cannabidiol oral solution for the treatment of patients with Prader-Willi syndrome. The study included only patients with genetically confirmed Prader-Willi syndrome who were hyperphagic and between the ages of 8 and 17 years. After an initial screening period, those who passed screening had a 1-week placebo run-in, then were randomized to 13 weeks of treatment with either CBD oral solution or placebo, followed by a 12-month open label extension. The study was to take place across 12 sites in the United States with the intent to enroll 66 patients. The study was powered sufficiently to serve as a registrational study if completed. The endpoints I'll discuss on the next slide. The study was prematurely terminated due to previous sponsor insolvency after only 7 patients had been enrolled. The endpoints. Hyperphagia Questionnaire for Clinical Trials, or HQCT, is a 9-question scale assessing a variety of hyperphagia-related behaviors developed for use in clinical trials. Each question is scored from 0 to 4 with a maximum total score of 36. The Clinical Global Impression of Improvement, or CGI-I, is a single rating on a 7-point scale assessing the overall change in the subject's condition compared to baseline, ranging from very much improved to very much worse. Another endpoint was change in total body weight compared to baseline. Of the 7 patients enrolled in the study, 4 received CBD oral solution and 3 received placebo. The average age was 12.7 years with a range of 8 to 15 years. 3 subjects were female and the majority was white. 4 were receiving growth hormone, 2 each in the placebo group and the treatment group. The mean BMI obesity was class 1 with borderline class 2 in the CBD arm. There was 1 markedly ill patient in the CBD arm, and the rest were normal, borderline, or mildly ill as assessed by the Parent Global Impression of Severity scale. 2 subjects completed the full 13 weeks of treatment, and the remaining subjects completed a variable amount of time on the study. The average treatment duration was 71 days for those receiving CBD, with a range of 63 to 92 days, and 58 days for those receiving placebo, with a range of 35 to 89 days. Dose adjustment was allowed, so 2 patients receiving CBD had the dose lowered from the 40 milligrams per kilogram today to something lower than that they could tolerate. In the graphs I'll show you next, the CBD treatment group is represented in green and the placebo group is represented in gray bars. When comparing the HQCT scores at visit 3, which was the end of the placebo run-in period, to scores at the end of the study, in the CBD treated group compared, there was a 6.5 point reduction in the CBD treated group compared with a 4-point reduction in the placebo treated group. And this is the information shown in the left graph. The mean treatment duration was 10 weeks for the CBD group and 8 weeks for the placebo group. 2 sub-analyses were conducted to address the HQCT score variability. First, shown in the center graph, HQCT scores from visit 1, the screening visit, visit 2, the beginning of the placebo run-in, and visit 3, the end of the 1-week placebo run-in, were averaged and compared to scores at the end of the 13 weeks. This showed a 6.2 point reduction in the CBD treated group compared with a 3.1 point reduction in the placebo group. Second, shown in the right graph, placebo responders were included. Placebo responders were defined as patients who had a more than 6-point reduction during the run-in period. This amounted to excluding 1 patient whose HQCT score dropped by 8 points during placebo run-in and a further 12 points during the placebo treatment period. Both of these sub-analyses were consistent with the main HQCT effect. So, though the numbers are too small to permit statistical analysis, the results of the abbreviated phase 2 study warrant further investigation of a possible effect of CBD on hyperphagia. There was also a positive trend toward a reduction in weight, shown on the left, and BMI shown on the right, with those on CBD in the green bars achieving an average reduction and those on placebo in the gray bars having an average gain. Number of subjects experiencing adverse events was similar in the CBD and placebo groups. There were no unexpected safety signals. The severity of diarrhea was mild to moderate. In conclusion, RAD11 is an investigational synthetic cannabidiol oral solution with controlled CBD purity containing no alcohol or psychoactive ingredients. Despite an abbreviated phase 2 study, the data are supportive of continued evaluation of RAD11's potential to reduce hyperphagia in Prader-Willi syndrome. There were no unexpected safety signals observed at the 40 milligram per kilogram dose. And Radius is committed to continuing the previous development program and anticipates initiating a phase 3 placebo-controlled trial of synthetic cannabidiol oral solution, RAD11, in individuals with Prader-Willi syndrome before the end of 2021. And I'll happily take your questions.
Thank you so much. Such an interesting topic. It's unfortunate that they had the financial issues that interrupted the development of these kinds of medications. You know, I did some review of cannabidiol and did a report actually at the last meeting that we were at. And one of the issues that I saw was that there's pharmacokinetic variability, and when there was a change in the bioavailability based upon whether the subject had been, the drug had been administered in a fed state or in a fasting state. Did you guys, was there any kind of accommodation for something like that, or did they observe that with this treatment?
I don't, there were too few patients where I could say anything about that, but I don't believe we may have specifically instructed patients to try to take their dose in a fasting state, but I can't honestly remember.
Yeah, I imagine it might not have been something that you would have seen. Now we have one question: is this the only study looking at hyperphagia aspect, or can it also look at the anxiety in PWS? So you're
yeah,
You're
we are
addressing hyperphagia mainly, but there is anxiety and other behavioral effects potentially.
exactly. So the study that was previously conducted and had to be stopped early was not emphasizing anxiety, but the phase 3 trial that Radius is planning will address or will be looking at both the hyperphagia and the anxiety or behavioral component.
There was some question about, you know, digestive tolerance, whether individuals had diarrhea and stuff. Sometimes with these vehicles, that sometimes you get GI symptoms.
Yes, we did see that. And in fact, 2 patients in the CBD group did have their dose lowered from the maximum dose of 40 milligrams per kilogram per day down to 30 milligrams per kilogram per day because they tolerated that better.
Thank you for your presentation, Dr. Bird. This is, it's a small sample, and there were problems with, the conduction of the clinical trial. I'm wondering, what might you say to people that are viewing this and thinking, wow, this is really exciting. It looks like it's a potential, thing that could be helpful, and people kind of wanting to try to get this stuff out in the public sector. Would you have any comments or any caution or anything like that from your experience?
Well, these are very preliminary data. Obviously, only 7 patients. It's very hard to say anything. It's just enough to tease you, really, to tantalize us. But I think the thing that's important about this trial is that the CBD used in this trial is, of course, synthetic, and so the amount is very precisely known. I worry about products that are obtained just on the market out there for consumption, because we don't know all of the various contaminants that might be in those. Hopefully they are well manufactured and don't have a lot of the psychoactive potential products in them. But those would be my main concerns, is that it's hard to know. It's hard to know exactly what you're getting.
We had a question, because we've had in previous conversations discussions about sweeteners, and there was a question about the idea of adding saccharin to this medication. And I don't know if just administering something in a single dose would be that relevant.
Well, I don't know how necessary the saccharin is, but I imagine that that there may be a bitterness that we're attempting to make more palatable. But hopefully, the relatively small and infrequent dosing is not something that will affect people's overall desire for that taste. But it's a concern that I hear.
Yeah, I guess it probably is something to do with masking an unpleasant potential taste. And so, yeah, I suppose that would be a consideration in this population. It's a question whether or not the simple administration of a medication would be that much of a trigger, but it could potentially be, I guess, in this population. So, Dr. Poggi, do you have any further comments? I think, are we wrapping up?
No, thank you very much. If there are no additional questions, I'd like to take this opportunity again to thank Dr. Bird and thank everyone here, and encourage everyone to complete their survey of the presentation when you get a chance. And so that's available through the attendee hub. So thank you very much.
Welcome.